From Vermont Public, this is The Frequency. I'm Mitch Wertlieb. It's Monday, July 28th, and here are today's headlines. A new report from Vermont's Agency of Natural Resources finds the state likely missed a major deadline to curb greenhouse gas emissions this year. The deadlines to cut back on these climate-warming emissions are set in state law. The environmental nonprofit Conservation Law Foundation sued the state last year over its failure to make progress and how it measures that progress. A judge dismissed their case this month, saying it was too broad in scope. Elena Mahaly is with the foundation.
We've got a lot of work to do, and I think there's a difference between saying that something is too hard to achieve and just stopping versus saying something is too hard to achieve, but we're going to keep trying.
Vermont is also projected to miss its next emissions deadline in 2030 by 30%. State regulators say they face financial challenges for climate action in the next few years, as many state programs are losing federal funding. Planned Parenthood health centers across the region cannot get reimbursed for the care they provide to Medicaid patients. That's after a court order that allowed them to temporarily continue receiving payments expired last week. Earlier this month, Planned Parenthood sued the Trump administration over part of the recently passed federal budget bill that effectively bars their health centers from receiving federal money for the next year. The policy applies to any medical services, including cancer screening, STI treatment, and birth control. Nicole Clegg is the head of Planned Parenthood of Northern New England. She says the case is still playing out in court.
The challenge we have is we are just caught in this limbo. That's really sort of holding us hostage and holding our patients hostage.
For now, Clegg says health centers in the region will continue to treat Medicaid patients for free. But that could change if funding from the federal government or state does not come through. Vermont health officials are encouraging people to protect themselves from mosquito bites after they recently detected the presence of two diseases in the state. Mosquito tests revealed West Nile virus in St. Albans and Jamestown Canyon virus in Rutland. It's the first year the state is testing for that latter illness. Common symptoms include fever and headache, but it can lead to encephalitis in severe cases. There have been no human or animal cases of mosquito-borne illnesses reported yet this season. Some tips to prevent mosquito bites include wearing long-sleeved clothes outdoors, using insect repellent, and limiting time outside at dawn and dusk when the bugs are most active. Vermont is continuing to experiment with on-call bus service as transit companies grapple with rising costs and ridership changes. Randy Schoonmaker is with Southeast Vermont Transit. He says Springfield will be getting a so-called micro-transit bus service in the fall.
We are converting an existing single route, fixed route, to microtransit, so we're not cutting anything, we're changing service over.
Springfield will become the sixth town in the state to try a microtransit system. It allows riders to call or contact the bus company when they need a ride anywhere in the town. The transit company will hold meetings tomorrow and August 7th at the Springfield Public Library to explain the changes. Coming up, southwestern Vermont now has its first and only methadone clinic. Vermont Edition host Michaela Lafrac spoke with Vermont's Deputy Health Commissioner about how it will fit into the state's treatment strategy. That's after this.
Thanks for listening to The Frequency, where support comes from Alpine Telehealth, offering telepsychiatry solutions for Vermont hospital, community mental health, and primary care. Physician-owned and operated since 2018. Learn more at alpinetelehealth.com.
A new treatment center for opioid use disorder in Bennington recently became the first and only methadone clinic in southwest Vermont. On Vermont Edition, the state's Deputy Health Commissioner Kelly Doherty spoke with Michaela Lafrac about the new center's role in the state's hub-and-spoke treatment system.
We have 8 spokes now with Bennington within the state of Vermont, but we also usually include, there's a hub right across the border in West Lebanon, New Hampshire that many Vermonters access. So we usually say that there are 9. And so hubs are the only place where you can get methadone for the treatment of opioid use disorder. Methadone is highly regulated by the Drug Enforcement Agency at the federal level. And so you have to have certain, measures in place to be able to dispense methadone. So people who are in need of methadone or prefer methadone as their treatment of choice need to receive that at one of those 9 locations. Spokes, on the other hand, are primary care providers, other just sort of regular medical practices that have prescribers who can provide buprenorphine, which is another treatment for opioid use disorder. We have over 240 spokes throughout the state. So people who are accessing buprenorphine through a spoke, it's sort of just like when you and I go to our primary care provider and maybe get a prescription for a chronic illness. You go to the pharmacy, you pick it up, and that's that. So much more easily accessible than methadone, but methadone, works better for some people. So it's important that we have the access in the state for methadone within a reasonable geographic area.
Right. And people who are taking methadone, they need to take it every single day. So being
Yes.
geographically close to one of these hubs is very important. Before this center opened in Bennington, where were people in that area traveling to access methadone if they needed it?
Yeah, so most were traveling to North Adams, Massachusetts, but some were also traveling to Brattleboro or Rutland. And it is a huge barrier, even though North Adams is 30 to 40 minutes away. If people don't have reliable transportation, it can be a real barrier to get methadone, regardless of how far you need to travel if you don't have transportation. So we knew that there was a critical mass of people in the southwestern corner of the state that really needed the access to this treatment closer to home. So we've been working to open a hub in Bennington for several years. And so we are just thrilled that this is now open and people can access it. In fact, the grand opening and ribbon cutting was yesterday, and it was wonderful to see the support from the community.
Hmm. And it was a long road to this center's opening. It took about 7 years, right? Soup to nuts to
That's correct.
open this center. And I know one of the biggest delays was in renovating the space. It used to be a Family Dollar store.
Mhm.
What else was behind the delays?
We have had three different providers who have cycled through the efforts of trying to open a hub in Bennington. And the first provider, just there wasn't space available that was adequate at the time. So they couldn't find space and, decided to drop out of the project. I would say one of the biggest delays was the COVID-19 pandemic. So that really just kind of put so many things on hold because healthcare providers were, focused on the pandemic, and our existing hub providers were just focused on making sure that people could still get their medication, during lockdowns and things like that. So we are working with BART, which is part of Baymark Health Services, and they operate other hubs in the region. And so they came in, I want to say about a year and a half ago, 2 years ago, and wanted to work with us to open this hub in Bennington. And it took a little while to find the space. And the renovations were actually, didn't take quite as long as we were expecting that they would. But those things just
I've
take
never heard that
time.
sentence said in the state of
Yes.
Vermont before.
Yes, yes. So, and there's because methadone is so highly regulated, there are certain inspections and other things that need to happen. The DEA needs to come and visit the site, make sure that there are appropriate security measures in place. And of course, there are local, permitting, things that they needed to go through. So we're just so thrilled that it's now open and available to people in the Bennington area.
And you mentioned that Baymark Health Services runs other hubs
Hmm.
that provide methadone in Vermont. Those are in
Yes,
Berlin, Newport, St. Albans, and St. Johnsbury. And there
correct.
are three other hubs in Vermont. Those are in Brattleboro, Rutland, and South Burlington.
Correct.
And Kelly, to zoom out a little bit here,
Hmm.
I remember last year that we got the good news that opioid overdoses fell in 2024 for a second year in a row. How
Hmm.
are those numbers looking so far for 2025?
It's looking, at least so far this year, that the trend is holding. which is great news. And, we've been very focused on overdose prevention for many years now. And we can't really point to one single intervention because we've been doing so many different things to prevent fatal overdoses. But we are optimistic that the decrease is going to hold for 2025, at least at this point.
That was Vermont's Deputy Health Commissioner Kelly Doherty speaking on Vermont Edition. You can find an extended version of that interview on Vermont Edition's podcast feed or at vermontpublic.org. Thanks for listening to The Frequency today. We had additional reporting from Abigail Giles, Lexi Krupp, and Howard Weiss-Tisman, and Stephanie Colombini, who also edited today's episode. Our music is by Blue Dot Sessions. I'm Mitch Wertlieb, and I'll talk to you soon.